So today we're going to talk about basic infertility. I'm kind of your setup man. I'm the person who's going to kind of like introduce the entire aspects of infertility and then talk about the basic therapies that you can actually do. And all the other speakers behind me are going to be more specific. So we'd like to go ahead and at the end of this session, I'm going to go ahead and have you hopefully understanding the basic causes of infertility. I'm going to have you describe some of the diagnostic and therapeutic treatments for the infertile couple. And then I'm going to contrast all those office therapies with the standard of care right now is in vitro fertilization. My only disclosure is that I'm a founder and I'm on the scientific advisory board for a startup called Butterfly Bioscience. You know, you can't live in Palo Alto and not be in a startup. I mean, like if you're not in a startup, you must not be very good. You know, so this is our startup that I've been working on. We're developing a new diagnostic and operative hysteroscopic system. And this is primarily because of our interest in uterine lavage. But I will go ahead and, we're not going to talk about any of those things, but I do want to disclose that. Okay, so the outline for today is we're going to go ahead and talk about the evaluation of the infertile couple. I'll talk about specific treatments, and again, I'll talk about the in vitro fertilization process. I'm kind of the, like I said, then we'll segue to the therapies that are available in Palm Springs. So for the evaluation of the fertile couple, infertility is defined as when you have not conceived after about 12 cycles of effort. But if you're over 35, you shouldn't just set your calendar to 12 months. You should say, if I'm not pregnant in 6 months because of the loss of your inherent fertility after 35, you should really be seen sooner. And that's because if you have a fertility of, let's say, if you're under 35 and you have a chance of getting pregnant about 25 to 30% any given month, after about 12 months of effort, about 85% of the couples are pregnant. And at the end of 2 years, if you just go a little bit longer, only about 8 or 9% actually get pregnant after that, leaving that to be about 93%. So at a year's time, if you're not pregnant and you're under 35, you should probably see a fertility specialist. And then all those people who have not conceived, they're not infertile, they're subfertile. It means that we can still help them. In fact, my oldest patient right now who's pregnant is 56 years old. She's at our limit. She is 5 years postmenopausal. She's a labor and delivery nurse. Okay, you can imagine this, infertile, labor delivery nurse, watching people have babies all the time. She never met the right person until she was 50. She came to me at 51 and I said, you know, this is gonna be a little difficult. It's going to be a little difficult. We're going to have to get, you're menopausal. We're going to have to get donor eggs. You're not menstruating. We're going to make sure you got to restart your endometrium. But luckily she has a baby. And then I recently just had a 53-year-old deliver who also is very similar, but 5 or 6 years of effort because of all the difficulties. So there's hope. And I think, Mahar has got a great program in Palm Springs. I'm sure he can be able to help you.